The coronavirus may be new, but it's triggering something downright primal in many of us. Fear and anxiety. Psychiatrist and author Gail Saltz says the outbreak has all the features that would typically arouse such emotions, and she joins us to tell us just how to handle them and how to talk to our kids. Most importantly, Gail, good morning.
Good morning.
A lot of folks are really anxious about this, questioning everything. How long will this last? Do I need to stay put? I mean, what do you suggest to people and how they handle this mentally and emotionally?
First of all, I think people need to understand that what they're feeling is normal. You know, pathologizing or making yourself feel even worse about why am I so completely freaked out is not helpful, and it's not true. It is normal to be feeling anxious now because this is there are some dangerous things going on, and we have an evolutionary built-in system to react with anxiety to alert us to things that we should avoid and be concerned about. So it's normal. But there is, for many people, this feeling of lack of control and the scariness that it has health concerns involved. And so there are a number of things that one can do to feel that you have more control in this situation, and that will help with the anxiety. And those are following the directions that expert health advisors have suggested. You know, have your Purell, be stocked up on things, do your social distancing, do the things that feel like problem solving. But beyond that, you really want to do some things to reduce anxiety in general. And things that really help with anxiety, for example, are daily aerobic exercise of some sort. You can do that in your home. You can do that in your apartment. You can do it outside when you aren't around other people. And doing aerobic exercise reduces stress, reduces anxiety level. I would suggest that most people take their news alerts off their phone. Take things that are going to zing you on an hourly basis with some sort of information, much of which you don't need, some of which is incorrect, and pick one source, for example, cdc.gov, that you get the information that you do need on a once-a-day, maybe twice-a-day basis, but repeatedly having the news actually stokes many people, and that's really not helpful in terms of your anxiety. Pay attention to have regular sleep. If you are staying home, which many people are doing now, set up a structure for yourself. Get up at a regular time. Don't stay in your PJs all day. Put on your clothes. Do your work. Set up a workspace that feels comfortable to you, that feels more structured to you. Create a schedule.
Dr. Saltz, I'm going to interrupt you. It's all good advice. I'm sorry, I didn't want to interrupt you, but that's where I wanted to go next, actually. A lot of people are home now more than they ever expected to be, with people that they're not usually home with all the time, their families. This is a very changing routine. How can people try to adjust to some of that, because that alone produces anxiety in those close quarters?
It does. I mean, we're social creatures, and bonding is actually a way that we reduce our anxiety. So first I want to say to people that, yes, you may need to be home to social distance, but stay in touch with people that you normally stay in touch with. So this is the case where social media and other methods of using the internet and your phone are helpful. You want to have conversations with family, with friends, with coworkers. So continue that conversation to stay bonded and talk about how you're feeling if that makes you feel better. But as I was saying earlier, create a structure in your day. So set up your desk somewhere, not at the kitchen table preferably, but somewhere that feels reasonable, that you can get work done, and have a time that you get up, have a time that you have laid out that you do your various things. Take a break to do some exercise. Take a break to consider doing a relaxation technique. This is very useful for people that don't do it already. Now's a good time to start. There are many apps that allow you to practice mindfulness or other sorts of relaxation techniques. You can do this with the people that are in the home now with you.
That's great. All this is great advice. Apologies for interrupting here, Doctor, but I just want to ask one more thing quickly. We don't have much time.
Yes.
When you're talking to kids about this, how much should you do that? How do you handle that?
Kids take their cue from you. So if you can establish the structure, the calm, the routines, they will take their cue from you. And answer their questions, of course, as they have them. Don't volunteer more information than, frankly, that's developmentally appropriate or that they're asking for. And if you can stay, not, I'm barely calm, but, you know, we got this. We're going to get through this, and this is the way we're going to do it. We're going to follow these rules, so to speak. You will help your child to actually be able to stay calm and let them voice to you their concerns.
All good advice. Dr. Gail Saltz, thank you.